So tonight we will answer all together the Quality Basics quiz and followed by the Healthcare Quality Leadership Lecture. So let's get started.
Okay.
Okay, question number 57. Mortality reviews are a critical element of risk management and quality improvement conducted to determine. So when we say mortality,
This one is not clear.
I'm sorry,
It's not
the,
clear.
the
But
voice.
the voice is clear, but you cannot see anything in the screen.
Oh, really?
Mm.
It's coming here to me.
You can remove background. Click email,
There's no back.
right click on the mouse and remove background.
Okay.
Now it's coming.
It's coming now? Oh, okay, that's good.
It's clear now. Okay.
Okay. Mortality reviews are a critical element of risk management and quality improvement conducted to determine. When we say mortality reviews are conducted as part of risk management and the quality improvement to analyze patient deaths and identify opportunities for improving care. So we have choices here. Letter A, if the practitioners involved were appropriately licensed and credentialed. So it means that license and credential, verifying the licensure and credentialing is an administrative task. So it is not the central focus of the mortality review. For choice letter B, if treatments and patient care were adequate and appropriate, means this helps identify the any potential system failures or areas where clinical processes can be improved. For letter C, who was responsible for the mortality and what disciplinary actions need to be taken. So I said mortality reviews are not about assigning blame or determining disciplinary actions, but rather about improving systems and processes. For choice letter B, what the unit staff was doing at the time. So this is the statement that is focusing on patient care quality and safety. So what's the answer?
B.
Okay, letter B is correct. If treatments and patient care were adequate and appropriate. Yes, because this one helps identify the potential system failures or areas where clinical processes can be improved. Okay, good. 58. Healthcare purchasers and payers are demanding that providers demonstrate their ability to provide high-quality patient care at fair prices. Specifically, they are seeking. So when we say healthcare purchasers are insurance companies, government programs, or employers, and payers are those who reimburse for the healthcare services and are increasingly focused on the value. They want an assurance that the healthcare providers, such as the hospitals, clinics, or individual practitioners, can consistently deliver excellent patient outcomes while maintaining the cost efficiency. So we have four choices here. A, objective evidence that hospitals and other healthcare organizations manage their cost well. What's the meaning of cost well? Cost management is important but not sufficient without evidence of quality outcomes and satisfaction. For choice letter B, current performance. These are data that are useful but it needs to be tied to measurable and satisfaction. Letter C, baseline information. It is part of the performance analysis but doesn't address the need for evidence of quality and satisfaction. While letter D, objective evidence that hospitals and other healthcare organizations satisfy their customers and have desirable outcomes.
D.
So what is the correct answer here?
D.
B, boy, or as in
D.
dog? Dog.
Yeah.
Yes. Yes, that's the correct answer. So the healthcare purchasers and payers prioritize value-based care, meaning requiring providers to show objective evidence of positive clinical outcomes and patient satisfaction, which reflects the shift from volume-based to outcome-focused healthcare. Okay, let's proceed. Number 59, a healthcare facility has committed to improving the overall quality of care for patients and their families during their stay at the facility. Among these goals in improved quality of care are the goals of increased safety, better nutrition, and staff friendliness. Okay. And staff friendliness, the role of the CPHQ in improving quality of care includes all of the following, except means one option is incorrect about the role of the CPHQ professional. So we have letter A, providing each department of the facility with friendly reminders about patient safety. B, creating a disciplinary process for staff members who fail to treat patients in a friendly way. C, researching and providing the facility with different options to improve food choices. And C, developing an educational program to help staff members interact appropriately with patients. When we say here, providing each department, this means that the CPHQ involves regularly sharing a concise and positive messages to reinforce the importance of maintaining safety protocols. This is a proactive approach, helps keep patient safety as the top mind for staff, fostering a safer environment across the facility, while B, creating a disciplinary process for the staff is meaning that fall under the purview of HR management. It is not the CPHQ responsibilities. Okay, for the letter C, this one is involving identifying healthier, more diverse, and patient-preferred meal options that align with dietary guidelines and individual health needs. For letter C, involves creating a structured training initiative that emphasizes effective communication, empathy, cultural sensitivity, and professionalism. So what's the answer? Any answer?
C.
C?
Yeah.
Okay, the correct answer here is letter B, creating a disciplinary process for staff members who fail to treat patients in a friendly way. Okay, because all these three choices are correct except for one, the letter B.
Okay, good.
Okay, because the role of the CPHQ focuses on driving quality improvement through education, research, process enhancement, and fostering a culture of safety and patient-centered care. It's not about the disciplinary processes. Okay?
Okay.
For number 60, the CPHQ must integrate quality findings into governance and management activities. So this is about integrating quality findings into governance and management, which is fundamental in driving actionable improvements in patient care. So we have choices here. A, align payment or incentive systems, tying rewards to clinical objectives to improve care. So CPHQ aligns payment and incentives with clinical objectives to support the value-based care, emphasizing in measurable outcomes and high-quality patient care. While choice letter B, maintain the current governing system to provide a continuum of care, Maintaining the current governing system to provide a continuum of care ensures that patients experience seamless and coordinated healthcare services across various levels and providers. This approach supports effective communication, consistent care standards, and a unified strategy for managing patient needs from primary care to specialized treatments, rehabilitation, and follow-up. For letter C, establish administrative policies and procedures for governance and management. This provides a clear framework for governance and management, ensuring consistent decision-making, accountability, and efficient operations. For letter D, rewrite the bylaws to reflect current streams of data inclusion. Update the bylaws to align with modern practices of the data inclusion, ensuring they address current data sources, integration methods, and technological advancement. So which is the correct answer among these four choices?
One. A.
Okay,
Yes.
you are
Pay.
right. Yes, the correct answer is A. Align payment incentive system tying rewards to clinical objective to improve care. Okay. Next is 61. In healthcare organization, the quality department developed an indicator to measure the commitment of the staff to myocardial infarction guidelines. So the keyword here is guidelines. Okay, commitment of the staff to myocardial infarction guidelines. An indicator that measures the commitment of staff to MI guidelines is assessing how the guidelines are followed in practice, which relates to what? Of care delivery, A, process, B, structure, C, culture, D, outcome.
B.
It's a process.
The keyword here is guidelines.
It's a process.
Guidelines is
Yes.
already the system.
Exactly. It's the process. Correct answer is A, because process means focusing on the methods and actions involved in delivering care, such as adherence to clinical guidelines or protocols. What about the structure? This assesses the physical and organizational framework like facilities, staff qualifications. For culture, this evaluates the values, norms, and behaviors within the organization. What about the outcome? Indicators measure the result of care, such as patient recovery or mortality rates. Clear? Okay. Next, 62. All of the following are ways through which any organization leadership can enhance the spread of quality culture within the organization, except, okay, letter A, develop mission and vision statements. In developing mission and vision statement, this helps align the organizational goal with a quality-driven approach and promotes a shared quality culture. Letter B, assign quality professionals to lead the process of cultural transformation. Meaning assigning quality professionals can aid improvement but doesn't guarantee the spread of a quality culture. Letter C, adopt flexible management styles. This encourages adaptability, openness, and inclusivity, which are essential for embedding quality culture. And letter D, develop quality initiatives, meaning actively drives the implementation of practices that reinforce the quality standards. So which one here is incorrect? Yes.
B, assigning quality professionals to lead, which, as you said, it will not guarantee the cultural transformation.
Very good, because a true cultural transformation needs an active leadership and involvement from all levels, particularly the senior management. Okay. Okay, next, 63. evidence-based quality management promotes. Okay, when we say evidence-based quality management or the EBQM, this focuses on integrating the best available evidence into decision-making processes to achieve the highest standards of quality in healthcare. This promotes A, culture of excellence. B, culture of free from medical and medication errors. C, culture of cooperation. D, culture of no punishment. When we say culture of no punishment, yes, this aligns more with a just culture. What's the meaning of just culture? This helps create an environment where individuals feel free to report errors and help the organization to learn from mistakes. Okay, what about culture of cooperation? Cooperation is important, but not the core emphasis of the EBQM or the evidence-based quality management. For the culture of free from medical and medication errors, while reducing the errors is an outcome of EBQM, it is not the primary cultural focus. So the answer is A, culture of
Matter of excellence.
excellence, because this strives to achieve excellence by improving processes, outcomes, and overall organizational performance based on evidence-based practice. So that is the evidence-based quality management promoting culture of excellence. Okay. Number 64. During a surgical procedure, a small medical implement was left inside a patient. The follow-up surgery to remove the implement is an example of, any guess? Is an example of sentinel event, right? Because a small medical implement was left inside a patient. So it is a sentinel event. It results in direct harm to the patient. It is preventable through strict adherence to safety protocols like we do in the surgery, the sign in, time in,
Sign
and
out and time
time
out.
out and sign out. So surgical count procedures, the use of the radiopaque materials. Okay, so the follow-up surgery to remove the implement reflects an effort to address a deviation. So there is a deviation from the established standards of care. So choices are A, quality improvement, B, quality control, C, is it quality assurance, or D, total quality?
Quality assurance.
Very good. Yes, the answer is quality assurance. Why not quality improvement? Because quality improvement is focusing on the systemic changes to enhance processes and outcomes proactively rather than reacting to specific incidents. What about quality control? Quality control refers to monitoring and measuring specific outputs or processes to ensure they meet the predefined standards. It typically occurs during or before the service delivery. For the total quality, this encompasses a holistic approach to embed quality in all aspects of the organization, which is broader than this scenario. So the correct answer is quality assurance, because the act of correcting a mistake, so in the statement, is removing the implement, which aligns with the quality assurance, which ensures adherence to safety protocols and corrective actions. Number 65. The most effective role of a healthcare quality professional as a facilitator. Facilitator is also called leaders or a leader of change to quality culture in the organization. So as we know, leaders or facilitator play a critical role in shaping and fostering a quality culture within an organization. When leaders understand the principles and value of quality culture, they can model desired behaviors, allocate resources, and inspire staff to embrace and prioritize quality. So, what's the correct answer of these options? A. Education of leaders. B. Education of staff. C. Evaluation of performance. D. Designing processes.
Evaluation.
Evaluation of performance. Who else has the answer?
Education of leaders.
Education of leaders is the correct answer because by focusing on educating leaders, healthcare quality professionals empower those who are best positioned to champion and institutionalize a strong quality culture. Educating leaders equips them with the knowledge, skills, and mindset necessary to drive a sustained change effectively. Why not education of staff? It is also important. Staff education is important, but typically more effective after leaders set the tone and expectations for a quality culture. What about evaluation of performance? This measures outcomes and identifies areas for improvement, but is not a primary driver of cultural change. Designing process. This is a technical task that supports quality improvement but does not directly influence the cultural transformation. Number 66. Best to ensure success of quality improvement in the organization. So this question focuses in quality culture. So the culture of the organization is the most critical factor in ensuring the success of quality improvement efforts. Choices are A. Education level of quality leaders. B. People skills of facility leaders. C. Culture of the organization. What's the correct answer?
Culture of the organization.
The culture of the organization is correct. A quality-focused culture ensures that everyone in the organization, from leaders to frontline staff, aligns with and actively contributes to the improvement process. Why not the education level of quality leaders? It is also important. Education alone does not guarantee success without a conducive organizational environment. While people skills of facility leaders, an effective leadership is important, but it must operate within a culture that values and supports quality improvement. So the correct answer is culture of the organization.
Is it like a just culture or non-punitive culture?
I'm sorry?
Is it just like a just culture or non-punitive system?
Yes, just culture and non-punitive. Exactly. Okay. Let's move on now. 67. The performance indicator, which is total unscheduled inpatient readmissions within 48 hours, is a measure of. Is an indicator assesses how well the healthcare system manages patient care during their initial admission and after discharge. So, if there is high rates of unscheduled readmissions within 48 hours, this signals potential issues like poor discharge planning, errors in diagnosis or treatment, and procedures that may require patients to return for further care. So complications or unresolved issues, gaps in communication between inpatient and outpatient teams can lead to inadequate post-discharge management. So which among these four is the correct answer? A. Structure. Structure means refers to the physical and organizational framework like facilities, staff qualification. Okay, so which this indicator does not measure. What
Outcome.
about letter B? Process. Refers to the actions taken during the care delivery, such as the adherence to protocols. This indicator does not measure specific actions, but rather the results. What about letter C? The
Correct.
Okay, yes. So this
Outcome.
is your answer? This is your answer, Radha?
Yes.
Okay, yes. The correct answer is outcome. You are correct. The performance indicator, total unscheduled inpatient readmissions within 48 hours, measures an outcome because it reflects the results of care delivered. Specifically, it indicates the effectiveness of care provided during the initial hospitalization and discharge planning. What about for the process and outcome? While outcomes can be influenced by processes, this indicator is solely an outcome measure. Number 68. The number of designated women receiving breast cancer screening like mammograms in the reporting year measures. Okay, this measure assesses compliance with the screening process, which is part of preventive healthcare. So A, process, B, clinical outcome, C, process outcome, or D, is it process and clinical outcome? What's the correct answer?
The number of us
What's the answer?
in the reporting year measures.
It's a process
Process
outcome.
outcome.
Yes, the correct answer is process. It is a process. The number of women receiving breast cancer screening mammograms in a given reporting year is a process measure because it reflects an action or intervention being performed. Specifically, it measures whether the healthcare organization is following a recommended screening protocol or practice. Why not clinical outcome? Because this refers to the results of care, like detection rates, survival rates, which is not directly measured by the number of screenings. Process outcome. This is not a standard term. Outcomes typically refer to results, not processes. For the letter D, processes and clinical outcome, while the screening process may influence outcomes, this indicator itself does not measure the clinical outcomes. Okay, so the answer is letter A. It's a process. 69. Measuring the time it takes a nurse to perform a procedure addresses which of the following aspects of care? Measuring the time it takes a nurse to perform a procedure. This evaluates A,
Monitoring.
monitoring, B, process, C, outcome, D, structure. The focus in the statement is on the
The time.
execution of the procedure and its efficiency.
Efficiency is a process.
Okay, yes. The correct answer is letter B. Very good. Measuring the time for a nurse to complete procedure clearly focuses on the process of care delivery. Monitoring refers to observing or tracking performance or outcomes, but this option is too broad to describe the specific act of measuring the procedure time. Outcome. This refers to the results or consequences of care, such as patient recovery or satisfaction, which is not directly addressed by measuring procedure time. For letter D, structure refers to physical or organizational elements of care and not the actions performed.
And even in this question, the success or failure can be an outcome, but not the process. So in this, it is the process rather than outcome.
Yes. Okay. Okay, number 70. The number of productive hours worked by nursing staff with direct patient care responsibilities per patient day is A, structural measure, B, process measure, C, outcome measures, D, composite measure. What's the answer? The correct answer is letter A, structural measure. It is a measure of the resources and organizational capacity available to provide care. So this falls under the category of structure, which focuses on the attributes of the care environment, such as staffing, facilities, and equipment. It is not process measure because, as I said, process refers to the actions or procedures carried out to deliver care.
The structural measure.
I'm sorry? For the outcome measure, this refers to the results or impacts of care on patients. While
Number
letter
of
D,
product.
composite measure, it is not because it is a single specific metric that evaluates only one aspect of staffing, which is the nursing hours relative to patient days. Okay, so the correct answer is structural measure. Number 71, one of the aims in the treatment of severe community-acquired pneumonia is to maintain an oxygen saturation of more than 94% or 88 to 92% in patients with chronic obstructive airway disease. Ensuring adequate oxygenation for this condition is A, process outcome measure, B, structure measure, C, process measure, D, outcome measure. The question is focusing on the management of oxygen therapy. So as part of the treatment,
It's a
Okay.
process measure.
yes, it's a process measure because ensuring adequate oxygen is a process measure. Why? As it evaluates the implementation of an intervention during the care process. 72. In an improvement project to reduce the wait times in an emergency room, the time taken to be assessed by a physician is A, process measure, B, an outcome measure, C, a structure measure, D, not a suitable measure. When we say not a suitable measure, this is incorrect because the time taken to see a physician is highly relevant in assessing and improving emergency room performance. While C, this refers to the resources or infrastructure in place. Letter B, an outcome measure, refers to the results of care, like patient satisfaction, recovery rates, which this measure does not address directly. So the correct answer is letter A. This is a process measure. Okay, in improvement projects aimed at reducing wait times, tracking the time to physician assessment is an important process measure that helps identify bottlenecks or blockages and enhance service delivery. Number 73. In implementing a care bundle for the management of acute myocardial infarction, the recording of the extent to which smoking cessation
Implementing
counseling is provided
care
is a
bundle.
measure of A, structure, B, process, C, outcome, D, process and outcome. What is the answer?
Process.
What's the correct answer?
Recording of the extent to which the
Okay, the correct
It's a-
answer is it's a process. Recording the extent to which smoking cessation counseling
process.
is provided reflects the action taken as part of care delivery. So the provision of smoking cessation counseling is a process measure focusing on adherence to recommended practice in patient care. Recording keyword means process. Okay, that's the keyword. 74. Deploying a continuous quality improvement or CQI team would be first approach in addressing which A, several patients complain their call lights not answered during night shifts. B, several physicians don't allocate enough time for procedures which booking surgical cases. C, finance billing outpatient procedures as ambulatory surgery. D, results of pre-admission testing for inpatient survey are unavailable 35% of time, causing delays. What's the answer? Deploying a continuous quality improvement or the CQI team is most suitable for addressing issues that involve processes requiring analysis, collaboration, and system level changes to improve quality. So, what is the correct answer? Okay, the correct answer here is several patients complain their call lights not answered during night shifts. It is a systemic issue related to staff responsiveness, workload, communication, or workflow during specific times. A CQI team can investigate the root causes involving the stakeholders, like nurses and supervisors, and implement strategies to improve patient care satisfaction. Why not several physicians? This is more of scheduling or time management issue, which may require direct policy or procedural changes rather than a CQI team. Not C, because this is a billing and administrative issue better suited for a financial audit or compliance review, and not the results of pre-admission testing, because while this involves delays, it is more specific to workflow and coordination, which could benefit from CQI, but it might also require a targeted operational like the information technology fix. So the best answer is several patients complain their call lights not answered during night shifts. Number 75, an ambulatory outpatient care facility identifies an opportunity to improve the turnaround time for reports of x-rays performed at a local hospital. Which of the following groups should be involved in the team to improve the process? Improving the turnaround time for extra reports involves addressing the workflow, communication, and coordination between the two facilities. A successful improvement team should include representatives from all relevant areas. A, administrative representative from both facilities. B, primary care physician, clinic nurse, and clinical administrator. C, clerical, clinical, and administrative staff from both facilities. And letter D, radiologist, primary care physician, and clinical medical records. What's the best answer? Okay, the correct answer is letter C. Including clerical, clinical, and administrative staff from both facilities are all relevant areas that can comprehensively analyze and improve the process.
Why can't be D? Because it is the turnaround time for the reporting of X-rays. So if radiologist delays the procedure, how it can be? This is my
The
question also.
radiologist,
Yeah.
the radiologist, okay. Okay, why not letter A, administrative representative? Because administrators play a role, but they cannot address the detailed day-to-day processes that involve the clerical and the clinical staff. Why not B? This option focuses only on one facility and misses input
Performing
from
the
the
nursing.
radiology staff and hospital processes. And not
My-
letter D also, because these roles are also important, but they do not include the clerical staff who are essential for logistical and communication improvements.
Why I ask this question? Because this pose mainly regarding the reports of X-rays. So radiologists are the important component. The department of radiology is the important component of this one. So this was
Yes.
my primary question. That's all.
Mhm. Okay, because here we are we are trying to get what is the best answer here. So I mentioned that how to improve the turnaround time for the X-ray reports. This involves on how to address the workflow, communication, and coordination. So this means that this improvement team must have a representative from all of these areas. So that includes the clerical,
Okay.
because the
Technical
clerical
team are not
staff
doing the
the clerical staff manage the scheduling, report transmission, and documentation, while the clinical staff understand the clinical needs and urgency for timely reports, while the admin staff oversee process alignment, resource allocation, and interfacility collaboration. Is it clear?
Yeah, it's clear. Yeah, that's only because sometimes when this type of questions comes, it will be
Yes,
a bit
yes.
difficult to choose.
Yes, I do understand because you were got caught by the word radiologist.
Yeah.
Yes,
And it is
but
the turnaround time from the reports of
Mhm,
X-rays. So because we
mhm.
find this majority of the time, that's why we got the critical radiology reporting time on which we will decide the clinical decision. So that's why now this is one of the key performance indicator from the radiology department.
Yes, okay, because radiologist already done his part. So the one who will be delaying the workflow is the clerical staff, the clinical staff, or even the admin staff. So they have this role in facilitating to improve the workflow of the turnaround time of the X-ray reports. So
Thank you.
clear?
Yeah, thank you so much.
Welcome. So next, okay, the last number, 76. The best indicator used by an ambulatory setting to measure its outcome is A, number of admissions to the hospital, B, number of surgeries, C, claims data. In an ambulatory care setting, the number of admissions to the hospital is a key outcome indicator because it reflects the effectiveness of outpatient care in managing conditions. So the correct answer here is letter A, as they directly relate to the quality and impact of care provided in an ambulatory setting. For the number of surgeries, this measures
Number of admission to the
volume or utilization. So it's not outcomes. Claims data is useful for
number of admissions.
Yes, that's the correct answer, Radha. Number of admissions to the hospital as they directly relate to the quality and impact of care provided in an ambulatory setting. So that's the end of the quality basics quiz. Any further question or clarifications before we will proceed to our healthcare quality leadership lecture?
Okay.
So if none,